Hi, I'm Dr. Christine Anderson, or Dr. Chris as my patients call me, and I am a chiropractor who specializes in pediatrics and pregnancy. And I also have a fellow and a certification in childhood developmental disorders. And I am doing this series on autism for the month of April to recognize and contribute to autism awareness in the month of April. So last time I came on and talked about what is autism, what causes it, and I hope you go back and watch that first video, first in the series. Um, and then this one is kind of following on the tail of that. So I just want to recap because what we want to do is look at what is the general cause of autism and work with it that way. So let's recap a little bit about epigenetics as a cause of autism. And I put cause in quote marks because um, you know, it's not just one thing with autism, right? There's usually multiple factors. But in general, these factors are usually environmental when it comes to epigenetics. And these things can turn off gene expression of key genes that are needed for normal development of the brain because that development, the structure, will then dictate the function of the brain. So I talked a little bit about functional disconnection syndrome last time, but I will also post a link to a video I did just on functional disconnection syndrome, and we're going to circle kind of back to that in a little bit. Basically, what it is that one hemisphere of the brain is more developed than the other, and this creates a disconnect in the communication between the brain sides. It is not a pathology, the brain is not diseased. It's really more about how it's developing, how it's connected, and therefore how it is functioning. So let's just talk a little bit more about functional disconnection syndrome and autism. And this really explains the unevenness of skills that we see in children with autism or anybody with autism. And a good example of savant syndrome would be the character Raymond in Rain Man, the movie. I think it was back in the 80s. I'm not sure when that film was done, but it was done kind of right at the beginning of the awareness of autism because there were doctors in that film that, had no clue, and there was one that had just started reading about it. But it's a great movie if you haven't seen it, and Dustin Hoffman he was really kind of amazing in his acting skills portraying an adult with autism. But this really explains this issue, the functional disconnection syndrome. It explains the issues with social skills, repetitive tasks, repetitive movements. So all these things that we see that are characteristic of autism, and a child may have some and not others. That doesn't mean they have to have all of them. This is where the spectrum comes in. But most of these are issues due to the right brain issues. And that is why it's a universal theory that can account for all those symptoms in the spectrum. And the variations mean that there's going to be differences in the brain. All the brains won't be the same as far as how they're functioning because they'll be exposed to different environmental factors. And you can also have strengths in the weaker side and weaknesses in the strong side. So it leads to a very personalized action of what you're going to see within each child. So let's talk a little bit about red flags in autism and in the development. Now, I did go into a little bit more of this in a podcast I did with my daughter on our podcast, Your Baby's Brilliant Brain, and I'll put a link to that. But basically, this is another reason too why I suggest bringing babies in to see me throughout the first few years of life on a regular basis, so I can pick up on these red flags. And moms, trust your intuition. If something doesn't seem right, persist and press on this, because you might see physically they have postural asymmetries, head tilts. They might be using one side of their body more than the other. Their gait may be off, things like this. And then there's sensory. They might be more or less sensitive to the environment. So some kids like to be stimulated all the time. And then there's others where even just a little bit of sound or light, they have an issue, or they might have issues with food, with taste and texture. And then the social aspect, this is where they have little to no eye contact. And this is something that should start fairly early on. Babies should be responding and starting to laugh around 7 weeks. So this is something you can kind of pick up on early. And by 18 months, they should be getting your attention and pointing to things. So, it's like, what is that? What is that? They're pointing, they want your attention. And if they're not doing this, this is another red flag. And also if they're avoiding kids. Kids usually love other kids. They want to be around other kids. And if your child is shying away from that, this may be a red flag. Another issue is the delay in milestones. This is a part of normal neurologic development. And I do talk about this again with my daughter in another podcast, so I'll put a link to that. And I'll be talking more about this in the future on this YouTube channel. So if they're delayed in crawling, walking, and especially talking too, these are red flags that there might be something going on with the neurologic development that might be something that could turn into autism. So let's get a little bit more into the structure of the autistic brain. And when they've done imaging studies, the brain appears to be structurally normal. There's no pathology, there's no disease when they look at it. And the baby's heads are normal at the head size at birth. And then they actually have an overgrowth of their head until preschool. And then their brain and their head start to decelerate in growth as they get older. And in imaging studies of teens and adults with autism, we see that their brains are smaller than their neurotypical peers. And I prefer the term neurotypical than quote unquote normal, because really, what is normal? I don't know. So just comparing with children who appear to be developing in a neurotypical way. So let's get into a little bit about these studies supporting the functional disconnection syndrome theory of autism. And there have been some studies looking at connectivity. So starting in 2012, there was a study done in Carnegie Mellon University, and people with autism had difficulty recognizing body language associated with lying in comparison with the same IQ peers that were not diagnosed with autism. And so they found this underconnectivity between the two hemispheres, and then concluded that this underconnectivity may constrain the ability of the brain to rapidly adapt during learning. And this is part of what our brain does. It takes in the information, it pings around in there, and then it goes, okay, we need to do this, that, or the other thing because this is what's going on in the environment. And if that's not happening, that is a huge issue. A 2011 Neuron journal study was a large study of toddlers with autism. And they saw that they had problems with hemispheric synchronization, and that they could detect this in as kids as young as 1 year old. They also found a specific window of time in which the brain gets out of sync defines what you're going to see as the symptoms in a child with autism. And that is key. Keep that in mind as we move on with this, because I'm going to kind of get back to that. In 2010, again in cerebral cortex, there were some MRI studies done and found behavioral problems in 53 males who were late childhood to early adulthood. And that was a result of decreased brain activity between the connections of specific areas between the right and left brains, the two hemispheres, and the mature long-range connections had not formed. And therefore, the corpus callosum, that's the bridge between the two hemispheres, was smaller. And that is possibly an issue that we're going to see, because if you're not having that communication between the two halves of the brain, then one side is not going to know what the other side is doing. In 2009, Brazilian researchers published in Clinical Neurophysiology and found that abnormal brain electrical activity between the two hemispheres occurred in boys aged 6 to 14 that were diagnosed with autism. So again, we have this this disconnect between the two hemispheres of the brain, really sort of corroborating this functional disconnection syndrome, right? So let's get into a few more studies. I promise we're almost done. And in 2010, Dr. Robert Melillo, and this is the doctor who created and taught the Childhood Developmental Disorders program that I went through, well, he presented a 2009 paper to the European Society of Pediatric Research, and he found a decrease in the electrical activity in the right hemisphere of brains of kids diagnosed with autism compared to children who were developing, having a normal, quote unquote, neurotypical development. And he also wrote a paper that was in the Reviews in Neurosciences called Autistic Spectrum Disorders as Functional Disconnection Syndrome, along with Gary Leisman. And this delves very deep into the research based on this connection aspect of the two hemispheres. In 2008, researchers concluded that there is evidence that the abnormal long-range connectivity between structures of the social brain could explain the socio-emotional troubles that characterize the autistic pathology. So again, recognizing that this long-range connectivity between the two hemispheres is really key with what is going on in the brain of a child with autism. All right, so let's talk a little bit about how the brain connects. How does this all occur in the first place? Well, in 1949, a neuropsychologist, Donald O. Hebb, PhD, concluded that cells that fire together wire together, in particular brain cells, or neurons as they are called. So nerve cells, brain cells, well, nerve cells in the brain are called neurons, let's put it this way. So when brain cells fire together at the same time, they build a physical connection to one another. So this is the whole thing about timing. If you don't have synchronization of the timing, and you've got things firing not synchronously, then the brain is not going to be able to connect. And timing is crucial for this to happen. The right brain development begins in utero. Remember I said that autism we're finding is primarily an issue with the right side of the brain. Well, this starts in utero. So prevention of autism really begins before conception and goes on during pregnancy and throughout the first 2 years of life or so, 2 to 3, when that right brain is really turned on and developing. So this is a crucial thing to know, and this is why planning a pregnancy can be really, really helpful. All right, what goes into building the brain? Well, pretty much all brain cells are formed in utero, 100 billion. There's some exceptions, I won't go into that, but pretty much all of them are there. And then what happens is that we have sensory stimulation of taste, temperature, touch, light, sound, gravity, vibration, and all of those senses are going to direct those nerve cells and how they develop. So in other words, if a baby is put into a dark room without any sound or light or touch, they're not going to develop because their brain won't receive any stimulation. So when brain cells or neurons are stimulated by all those sensations, they're going to transmit the information to other nerve cells. And then that's going to create a new memory, experience, understanding. Something is going to happen. It's like, oh, something is going on. And this brain growth that babies get is due to those increase in connections. So by age 3, there are trillions of connections, and that is really what builds a brain to develop and function at a higher level. Now, there's other cells that are important called glial cells, and these are important for brain growth and neurotransmission. I'm just going to mention that. We're not going to really go into it too much, but they are really super important for brain function as well. Okay. So this brain connectivity is really a matter of timing. So remember in our studies, they talked about long-range connections that are coming from distant parts of the brain, crossing to the other hemisphere, and that really creates that bridge called the corpus callosum. Well, first what happens is local connections in the baby, which are more immature. So it's sort of like it starts in one place locally, and then as time goes on, the network of connection becomes longer and longer as that brain develops and matures. So these network of nerve cells wire together to be more efficient and powerful, so that what goes on doesn't have to be when one nerve cell gets stimulated. It doesn't need to stimulate maybe everybody in the chain. It has a network so that it can be more efficient. In other words, if you mow a path in a lawn, right? That's one path, and you keep mowing the same path, it's going to be well worn, all right? But if you start deviating and going like another way and meeting up at the end and the other way and meeting up at the end, it's like, well, which way do I go for this path? Okay, so this way it keeps developing the same network, the same pathway, so that things almost become automatic. And just think about habits and things that you do now as an adult that may have been very difficult as a child, or when you watch a baby start to learn a new skill and they are very clumsy, it's not easy, but they keep doing it over and over again. They keep mowing that pathway. As long as they're given the right opportunities for that sensory stimulation, it's going to occur. Now, in an autistic brain, environmental factors that cause epigenetic changes that turn off genes that are responsible for building those connections in the brain are typically during right brain growth. So remember, we talked about right brain starting in utero. So if there's issues with the timing where it's misfiring, the right side and the left side aren't in sync, you've got sort of spotty firing, it's not going to wire together. That path is never going to get mowed through. There's not going to be those connections made. And this is where things start to break down with their development in the structure and then therefore the function. So there's a couple of other parts of the brain that are affected in autism. I'm not going to really go into this in depth, but it's just something you should know. And I've got a brain there. The first one, the limbic system, it's actually not labeled, but it's kind of over near where the hypothalamus is, and down in that sort of darker brown area, sort of right in the central part of our brain. It's the more primitive brain. It's where we store a lot of our emotions, especially with survival, like fear and anxiety. It's very motivating that way. If you think your life is in danger, you're going to act very quickly. There's also, that's the emotion and behavior connection. There's also long-term memory stored there, and the sense of smell. So a lot of primitive animals rely on their smell to know that there is danger or that something is okay. And this is where we get sort of the reptilian, people will say the reptilian brain, something like that. That's the limbic system. Our cerebellum is right underneath the cortex, or the main part of the brain at the back of the head, and it is labeled there. So, kind of like a man bun type of thing, or a bun at the back of the head. It regulates cognitive function, so our thinking brain, and it also is involved in coordination. It's involved in learning and reading. There's a lot of things that do go on with the cerebellum. The prefrontal cortex is the front part of the brain. It also, it's labeled the frontal lobe. It's also called the frontal lobe sometimes, but it's a part of the brain that really is tied to social behavior and personality. And then we've got our brain stem, and you can see there's labels of medulla and pons. Well, that's part of the brain stem. It's the connection between the cortex and the spinal cord. And this is an area that is really the beginning of brain development, starting with the primitive reflexes, and the brain will climb the ladder of the brain stem and then start to develop the brain from the back of the brain to the front part of the brain, and then at the same time developing side to side. Brainstem is also revolving around proprioception. That is your ability to perceive what you are feeling. It's also internally in your joint system, so your brain will know where your foot is. And so it's really about knowing internally what is going on with your body without really consciously thinking about it. You don't really have to think about you're hungry, right? You're just hungry. Well, sometimes this isn't so easy for kids with autism. And then there's also the reticulating activating system that I didn't put in there, but it's involved in the wake and the sleep cycle. So just a few things to know about the other parts that can be involved. And then we have neuroplasticity. So the brain really does have the ability to change throughout life based on the stimulation and the training that is received. And again, you have to have something that is stimulating the brain. So all the things we talked about, light, sound, touch, taste, gravity, vibration, all those things are felt in the body, sent through the sensory fibers to the brain. The brain goes, okay, what is going on, and then responds to it. This is how the brain develops. This is what it is supposed to and designed to do. But it has to be done in a way where a few things have to happen. In other words, you have to have the exposure to the right stimuli at the right time with the right amount of frequency. So in other words, let's put this into context of a mom who carries her baby. She wears her baby all the time. That baby will get some stimulation because of mom's body, because of the movement, but that baby is also confined to one place and won't be able to move its own body to see what it needs to do to, say, roll over or start to crawl. So a baby who's constantly carried isn't going to be able to get that right stimulation to be able to get to those milestone steps. They have to have that opportunity to move, and if they're not given it, then there might be problems with milestones and the brain not getting the right stimulus. So that's one example of what can happen. But when we give the right stimulation and the right training and the right frequency, so it has to be done over and over and over again. You can't just do one thing and then you're really good at it. Think about when you were driving a car at first. You're like, I don't know, what am I doing? You have to think about everything. Your reaction time is slower. And then when you've been driving for a number of years, it's easy. You don't even really think about it because you have done it so many times that your brain is functioning without you actually even thinking about it. So this is sort of what we're talking about here, and this ability can occur throughout life. So this is a great thing because if we have had an issue with development, we can come back to change the brain of a child with autism by stimulating the weaker side of the brain, stimulating the things they're really bad at by getting them to do the things they're really bad at until they're no longer really bad at them anymore. So, believe it or not, studies have shown that within 2 hours of learning something new, there are measurable differences in the size of the nerve brain cells or the neurons. So, oh, and by the way, there was one thing on there, use it or lose it. You can also lose. The plasticity goes both ways. So, you can build that plasticity and have those changes. But then if you don't do something for a while, you will get rusty, right? It's like, oh man, I feel like I got two thumbs again. So you do have to keep that brain stimulation going. You can't just do it and then you're good forever. So let's talk a little bit more about how this applies to autism. Again, we want to stimulate the weaker areas of the brain so that they can get, quote unquote, stronger by creating more connections. That's really what it's about. We want to connect. We want the brain to connect. So I've listed just a couple of things here that I use in my practice to help with this aspect. So chiropractic and cranial sacral therapy. I've gone over a couple of these things in videos. I will see about putting links, but in particular with chiropractic, most people don't realize that it's really about the nervous system and not about the bones. Yes, sometimes there is a popping sound if somebody is getting a high velocity adjustment, but there's some low force and no force techniques that work really well too. It's about releasing any interference to the nervous system for the brain to have top-down control of what's going on in the body. But there's also the reciprocity of being able to interpret the sensations from the body too. So we want a clear highway on both ends. So by releasing any of what we term subluxations, we have that restored. And there is, especially in the upper neck, it's sort of like a super highway of stimulation into the brain. It's supercharged. So this is one way to create that sensory experience to kind of turn the brain on. With primitive reflex exercises, that's down in the brainstem, this is a way to start with developmentally getting that brain to build from the bottom rungs. If there are issues going on, and that's something I check in my office and then give exercises to get those reflexes to integrate. I will be talking more about this in the future. Specific sensory motor exercises are going to target the weak areas and the weak hemisphere within that those areas are in. So that's for each child is going to be different. I will use interactive metronome, and that helps with the timing of the brain. I will use bio and neurofeedback, and this is again part of this training where we can teach the brain how to respond by feedback that the child or person is getting. And then a frequency optimizer I use. So this is a fairly new tool to my practice, and I'll put the links to frequency videos I've done and to the scanner. Although this, they put on a number of things I have to do an update. But the reason why I love this for working with kids with autism is that it's a passive type of treatment where we are using frequencies to help with cell and organ and body function. And there's actually programs on there, subtle energy frequency imprinting, that can be done specifically for autism, or if that child is having anxiety or any other issues going on. So it can be really helpful for use with everything else going on, especially in a child or an older child or adult who has quite severe autism, where it's hard to get their cooperation to do other things, where you have to do things passively. Essential oils are another great tool to use. They have a great effect on that limbic system. Remember that reptilian brain, well, with smell, right? So this is a great way to do stimulation with using essential oils, and there are certain oils that actually activate the right hemisphere. All right, we're headed into the final countdown here. So I have put my website up there. If you are interested to see how I can help you and your family, just contact me. There are ways I can help you remotely if you don't live in Los Angeles, or I can possibly see if there's someone else that can work with you locally. But I've listed a number of things there that can help with this aspect of epigenetics and working with the hemispheres and the functional neurology testing versus looking for pathology, which remember there is none in the brain, and going all the way through to stress response evaluations, bio and neurofeedback, nutritional counseling, lifestyle modifications. There's so many levels that can be looked at here. So when a patient comes in, I do a detailed history, I do a detailed exam, and I meet that child where they're at. So we take things as slow as we need to help get them to a place where they're able to do more and more. So it can be pretty amazing when you are working with the brain and helping to create those connections. It is absolutely pretty amazing to watch. So next time I come on, next week, Tuesday at 6:30 p.m. Pacific time, I'm going to be talking about risk factors for autism. So this is going to relate back to if you're planning a pregnancy, are there things that you can do to decrease your risk of having a child with autism? So this is extremely helpful for those of you who are thinking about starting a family. All right, everybody, if you have questions, you can always reach out to me. And of course, give me a thumbs up and subscribe if you want to know when I'm producing new videos, and hit the notification bell. All right, have a great week, and I will see you next time.